And a very warm welcome to all of you, our listeners and our viewers. Welcome to the Information Command Center here at the studios of the Government Information Service. I'm your host, Tony Nicholas, and we are broadcasting on NTN, as well as the Government of St. Lucia Facebook and YouTube channels. We're also on WVNT 93.5 FM. Thank you once again for staying connected with us as we seek to bring you up-to-date and reliable information on the national response to COVID-19, as well as the various sectors within our society. To date, St. Lucia has recorded 18 cases of COVID-19, and we continue to do island-wide testing, and as of this week, there have been no new confirmed cases. Earlier on, we saw the announcement with regard to the reopening of school, and the green light has been given by the Chief Medical Officer, guided by scientific data, and protocols have been put in place for grade 6 and Form 5 students. There will be psychological first aid through support of school, community, and the Department of Health to calm some of the fears of both parents and teachers, as well as the students. The ministry will be working with CSEC students, counseling, virtual support, and the completing of online application. It will be the reopening for 16 days of school ahead of the CSEC and Common Entrance exams. Health and safety protocols remain at the heart of everything that is being done to ensure the safety of the students as well as the teachers. Sanitization of schools have continued, and primary and combined schools and secondary schools will be utilized during this period. The instructional period begins on June 2nd, and there'll be individual plans for each schools. There are 2,444 students registered for the CSEC exams and 2,198 students for the Common Entrance exams, which will be multiple choice only. Common Entrance will be June 29th. All secondary schools will be used on examination day, and CSEC runs from the 29th of June to the 17th of July. So we continue the discussion on the various sectors with regards to our response to COVID-19. And in studio today, we have with us Major Derek Mitchell of the Salvation Army. Welcome.
Thank you very much. Glad to be here.
How have you been coping with things and the circumstances?
Oh yes, I have. And I'm happy to say that I'm a Lucian today. I am living in St. Lucia, and St. Lucia has one of the best rates as it relates to recovery from COVID-19. So I am so happy, unlike many other Salvation Army officers across the world, I am living in St. Lucia.
Okay, so just for today, we won't mention that other country where you're supposedly from. We'll leave this one out for now. Tell us about the Salvation Army overall. I mean, it's a household name globally, yes. But just remind our listeners and our viewers what the Salvation Army is all about.
All right, the Salvation Army has been founded in 1865 in London, England, and it came out of need. There was a Methodist minister by the name of William Booth who saw quite a number of displaced persons, people living under bridges, alcoholics, drug addicts, prostitutes, and they were living below that dignified level. So what he decided to do was to do something about it. And upon ordination, he asked specifically to be sent amongst the poor to work. Unfortunately, he was not granted that request, and he was sent to a church. So he left the Methodist church and he went out there and he started what was called the Christian Mission. Over a couple of years, the Christian Mission evolved into the Salvation Army. Mm-hmm.
Now, talking about vulnerable persons and displaced persons, what have you been seeing over the years in our situation here in St. Lucia?
Now, St. Lucia, there's a high rate of homeless persons, although recently with the COVID-19, we have gotten so much more information about these so-called homeless people, because quite a number of them is not really homeless. Mm-hmm. They do have places of abode, but because of social conditions there, they have to be out there on the streets. And having a chance to liaise with some of them now, especially at this time, we realize that some of them actually have a home to go back to. Mm-hmm. Now, there are more persons there. There are persons there that actually live on the streets. There are some of them living on the streets because of mental issues, because of financial issues, and some of them, the truth of the matter, are addicts, addicted to drugs and addicted to alcohol.
With the onset of COVID-19, what has been your response in terms of interventions with some of those vulnerable persons?
Well, the Salvation Army has been consistent in providing a hot meal for every needy persons that come to our doors. Initially, when the pandemic started, we lost one of our sponsors, one of the hotels that always provide us with a hot meal. So we started cooking within our kitchens. At the Salvation Army, we have a basic school that was closed down. So we were upstairs using a kitchen, and we have another kitchenette downstairs. And we were able to put out about 50, 60 meals. And we go to the corner high street and provide a hot meal for the street people. After a couple of weeks or a couple of days into the pandemic, the government did something good by putting something in place, taking them off of the streets over to the Vigi Sports Center. And we did assist over there for a period of time with the meals. Now we have most of them still back on the streets again. And we have been providing a hot meal for them every single day, Mondays to Fridays out there.
You spoke about the support granted to you by one of the hotels. What other support do you get institutionally for the programs that you carry out?
Okay, now we have, and I hope I'm permitted to call the name of my sponsors. Massey have been so good to us. Sandals have always provided us with hot meals every single day. But since Sandals have been closed down, Massey have taken up the slack. And what they usually give us in the past, they have actually increased it. And because of the kind donations of Massey and the kind donations of some other sponsors, some private people that always tell me, please don't call them name. And I want to talk about Dr. Jeffers, right? And I want to talk about Helen Charles. You know, these people have always contributed to the Salvation Army, and it's because of their generosity why we are able to be at the forefront in alleviating poverty in St. Lucia.
What would you say we could do to reduce that level of poverty that we've seen? We mentioned earlier on about the displaced persons and being affected not just by the lack of food, mental illness and what have you. How could we tackle those issues realistically? It
has to be a joint approach. We need to have a unified front with some of the social organizations, with the Ministry of Health, and with other organizations that are assisting in the various areas, the Ministry of Social Transformation, stuff like that. There need to be some social intervention in some of the families. There are in other Caribbean countries now where when somebody is elderly, becomes older, right? We see a lot of old people now on the street, sitting down on the street corners and things. I can tell you right now where I'm from, it's like if we find the daughter or the son or the children of these people, they need to take the parent or their grandparent off of the road. And if they don't do it, they're going to be prosecuted. So legislatively, we need to have something in place where children have a responsibility for their parents and for their grandparents, just like how the parents have a legal responsibility for their children. Something like that is needed.
Besides your feeding program, what other interventions are you involved in?
Okay, we provided several grocery hampers for needy families because, you know, everybody is affected economically. There's so many job loss, so many Lucians are dependent on the hotel industry, which is a non-existent industry right now. So we try to provide grocery hampers for them where we are able. I have to mention that we have a huge project coming on stream where we'll be providing up to maybe 1,000 grocery hampers over the next, I should say, a week or so. Again, this will be the second phase of our provisions for those families that are impacted negatively as a result of the COVID-19.
And in terms of persons who may be interested in supporting you, donating to you, how could they reach out to you? And what are your most pressing needs at this time?
Pressing need is food stuff. We're cooking every day. And we don't have an income. We have a basic school. We have a daycare services. And our daycare is a unique daycare. And if you can, you know, so I'll indulge me, we initially take those single parent families. We take the child from that mother and we keep that child between the hours of 7:30 in the morning until 5. So that woman now becomes employable. She go out there, she can get a job, she can become viable. After she working, so we are expecting her to pay something for the services. So we'll get income from that. We would get income from our basic school. I would get donations. The income from our basic school and from the daycare, that has dried up. So we do receive some donations. Our greatest need is more foodstuff, donations. We still have operational costs. I have to mention, I do have a team of volunteers. We have a group of young people now at the Salvation Army that is actively involved every single day. They help us to cook. They help us to provide clothes for the street people when they come in for a change of clothes. We have been asked to assist at the Cornerstone Mission. We provide a hot meal every day at the Cornerstone Mission, and we're still giving out grocery hampers. So our greatest needs at this time is food stuff that can be cooked, and we always welcome cash donations.
Okay. In terms of the school that you mentioned and the daycare, how are you preparing to reopen those facilities?
We are working closely with the Ministry of Education, and we will be following the protocols that have been established. I know there's going to be some kind of social distancing, and I know it's still being worked out, but we plan to adhere to anything that the Ministry of Health and the Ministry of Education put forward to. Okay,
sounds good, Major. Just final words from you, final thoughts, and a final appeal for persons to assist you as much as they can.
Well, it would also come in the form of a preamble for your next guests. With the quickly approaching hurricane season, there are some concerns that everybody is having if we're going to have an active season. But the truth of the matter is we have a very good team of NGOs, and we have NEMO in place here in St. Lucia that has been always at the forefront in planning, in preparing to deal with these things. My biggest concern, as I say, if we were to be unfortunately struck with a hurricane this year, what is going to happen, you know? And we look forward to maybe hearing from your other panelists later on to deal with that. As it relates to the Salvation Army, our basic school and our daycare, we have a number of children that are registered to our institution that their parents came to the Salvation Army basic school.
Okay.
And their parents' came to the Salvation Army basic school. And we know that they will be back. We'll be getting back our children. And one of the reasons we will be getting back our children is that we are not afraid to say that we give them a Christian foundation, a Christian education. From them is the baby. Them learning to sing Jesus Loves the Little Children, go right back till they come out of our charge.
And most certainly going into the hurricane season that you mentioned, we do need as much divine intervention as we could possibly get. So thank you for that, Major. Thank you for bridging that gap for our next guest who will be joining us after our break. We take a break, and when we come back, we'll introduce to you, our listeners and our viewers, to our in-studio guests.
Thank you.
Coronavirus? I am worried, Gassa. It's only old people dying from that.
Hold up. Being young does not mean being safe. Yes, it's true that the elderly are at higher risk, but anyone can get the virus. The effect is even worse if you have a chronic condition like hypertension, heart disease, lung disease, and diabetes, or weakness in your immune system. If you are living with these conditions, be extra careful. Wash your hands with soap and water. Use hand sanitizer with at least 60% alcohol when hand washing is not possible. Avoid touching your face. Take steps to boost your immunity through proper nutrition, exercise, rest, and take your medication as prescribed. Limit being around people who have flu symptoms, even close family members.
Our health is in our hands. Together, through simple actions, we can stop the spread of coronavirus. This message was brought to you by the Bureau of Health Education of the Ministry of Health and Wellness.
And in the latest news, the coronavirus, or COVID-19, continues to be a health emergency across the world. Caribbean people are concerned.
Everybody know about COVID-19. COVID-19. Keep socially distance and your proper hygiene. Wash your hands then clean. And don't discriminate, cause it might be. It very well could be somebody will look like you or look like me. Listening. We're in this together. We all got to work with each other. Look out for our friends and our neighbor. And if you feel sick, don't be afraid to call the doctor.
Red Cross
It's volunteers from across the Caribbean, working hard to fight discrimination. So if a person should feel ill, then they will contact the authorities without hesitation. The most vulnerable are the elderly, but the truth is it can infect anybody. So what we need is solidarity, everyone helping everyone like a family. So this is a message to the nation. Make sure you seek out the right information from official sources like the Ministry of Health, Red Cross and the World Health Organization. Everybody know about COVID-19. COVID-19. Keep socially distance and your proper hygiene. Wash your hands then clean. Don't discriminate cause it might be.
And welcome back. Thanks for staying with us. In studio with us now is the Director of NEMO, Ms. Doreen Gustave, as well as the Chief Meteorological Officer, Andre Joyer. Welcome to both of you.
Thank you.
I shouldn't be saying welcome to Ms. Gustave. It's like she's family now. She's practically a member of the Information Command Center. So today we'll be talking about, well, the pending hurricane season. Or I'm not so sure if it's pending. We already had one tropical storm being formed, as well as preparedness. We're talking about preparedness here today. So maybe I could talk first to Mr. Joyer. What are we hearing? What are we seeing? What is the science telling us about the upcoming Atlantic hurricane season?
Well, like you alluded to, it will be an active season. All the scientific evidence is pointing to that. We have a number of institutions that give us the predictions for the year, and it's not encouraging. We have institutions like the National Oceanic and Atmospheric Administration. They just put out the 2020 predictions. They did that on the 21st, and they're going for, it's a range that they're going for. It's between 13 and 19 named storms, 6 to 10 hurricanes, and 3 to 6 major hurricanes. Now, I should say that the average for the year is 12 named storms, 6 hurricanes, and 3 major hurricanes.
Okay.
So everything would be stepped up. The Colorado State University, which was one of the first institutions to actually put out predictions, they're going for 16 named storms, 8 hurricanes, and 3 major hurricanes. We also have the British, the University College out of London. They're going for 16 named storms, 8 hurricanes, and 3 major hurricanes.
Now, before we even begin to put this into context, we're already facing a crisis, that of the drought. It's been said that it's one of the worst droughts we've been experiencing for quite some time now. Tell us a little more about this drought season, the dry season, this long dry spell.
Yes,
although this week we saw just a few trickles.
Yeah, well, we use the CARICOF, it's the Caribbean Climate Forum. They're a regional organization out of Barbados, well, at CIMH, that's the Caribbean Institute for Meteorology and Hydrology. They use indices to predict droughts, and we actually have our local prediction that we use, our own data. So both the local and the regional shows that because of the drying trend from last year, we've been having below normal rainfall for the entire year, 2019. So we didn't have the recharging of reservoirs. So that has caused our rivers and the reservoirs to be at a lower level. And then the drying trend continued into 2020. So we have reduced rainfall, and that is causing a lot more problems.
When you say below normal, what is the normal and where are we
okay, for
right
each
now?
month, we have a normal that we expect. So we go over a 30-year period, and we average out. So for April, the average was supposed to have been 71.3 millimeters at Hiranora and 64.8 millimeters at George Charles, because that's where we have the most data at the 2 airports. For April, we only had 14.3 millimeters at Hiranora.
Wow.
And at George Charles, 12.6 millimeters.
Wow.
So that's like 20% of the normal rainfall that we're expecting. And coming into May, it's still low, even though we had a particular shower that everybody thought that's the beginning of the rainy season. It was just a tropical wave that came across and had upper level support. So it came up to the island, to St. Lucia and Martinique, and gave us a few showers. But the prediction that we have been saying is that we will be having below average rainfall for the next 2 months, May, June. That doesn't mean we will not have rain. We will be having rainfall, but it will not be significant to replenish or recharge the reservoirs and the rivers.
Because that's what persons are saying. When they see rain, they believe automatically, hey, Wasco starts getting all the calls and everything. Where's the water, Wasco? There's rainfall. What's happening?
Well, we are working in conjunction with Wasco and WRMA, the Water Resource Management Agency, and NEMO. So it's not a one organization decision. It's a team effort.
Ms. Gustav, in terms of NEMO, most times when persons say NEMO, the focus is usually on hurricane. Obviously this year we saw NEMO being kicked in with COVID, and now even with managing the whole water crisis. Just speak a little about that.
Okay, so NEMO as a body, the wider body, which you just heard from Mr. Joaye, that NEMO works with organizations that fall under the wider umbrella. So we are responsible for anything to do with emergency. So where there is, with COVID became an emergency, and then we had the drought situation. We have the drought situation that became a water emergency, and now we are heading into the hurricane season, where most persons know NEMO about handling the hurricane and emergencies of sorts. So we are not just responsible for hurricane. Anything that is impacting the nation as an emergency, NEMO is responsible for.
Now, all of these situations you mentioned there, with COVID, the health crisis, the drought, hurricanes, they cannot be prevented.
No.
But what we constantly seek to do is educate and inform persons about preparedness.
That's right.
Let's talk a little about preparedness.
Okay, so from NEMO's end, from last year, we have been preparing for this hurricane season. We have to take into consideration climate change, the impact of a Category 5 that, as we have seen in our neighboring islands, what it has caused, the devastation that it has caused. And so we in St. Lucia wanted to prepare ahead of that. And so we started our preparation. We started our meetings. We started our training. We needed to strengthen our district disaster committees. We are aware that they are our eyes and feet and hands and what have you on the ground. And if they are not strong enough, NEMO is not able to respond. So we started with this group, the district disaster committees, where there was need for election. We started. But however, due to COVID, we had to put this on pause. Although we were still in discussion with this group, but we had to immediately respond to COVID because that is our role. Amidst COVID, we are now preparing, we are continuing our preparation. Yes. So we have done training. We have met with our supplies and welfare committee. We have met with the flood and drought committee, as you heard from Mr. Joaye. We are discussing shelters. So they have started looking at the inspection of shelters. We've done more than 50% of that. And we have to take into consideration COVID-19 and shelters, whereas a shelter would be able to accommodate, let's say, 100 persons. Taking into consideration social distancing, we had to look at more than one shelter per community. Okay. So we are looking at maybe private shelters. This is what we are thinking. There is a need for that in order to accommodate based on the impact. And so we had to put protocols in place. We just completed protocols for shelters. Ministry of Education was on board, Ministry of Health was on board, the Shelters Committee was on board, NEMO, and we discussed, you know, what is needed. And it's going to take a huge amount from our finances that we already have depleted. So we have discussed also with the team from Ministry of Finance, just outlining what it is that is required in a shelter to put all of the protocols in place and to adhere to those protocols. So we have done that. We see the need for engaging all of society, and that includes the business community, and we have started our training in business continuity with the Chamber of Commerce that is ongoing. And the other thing that we have started discussing is the continuity of government. We realize that government, with COVID, the various ministries had to shut down. Yes. And only only essential ministries had to continue on a smaller scale. So we have to put measures in place to respond to any sort of emergency. And so we have started discussing how we're going to engage the public service to put their business continuity plans in place. Through the University of Bournemouth, that was engaged by CEDIMA, we are having a training on the 4th of June to discuss situational awareness. And we're bringing all of our partners, all of NEMO, essential services, the various ministries, the various PSAs who have to respond during a disaster, to the EOC. We are putting also, we have also through the World Bank gotten approval for the equipping of our Emergency Operations Center. We realized that last year, because of technical difficulties, we were not able to send our messages out in a timely manner. And we had to look at all of the gaps that exist in our emergency in St. Lucia. So that was one of the gaps. We could not get our messages out in a timely manner. And so what we have done is through the World Bank, we are doing the equipping of our EOC, networking of the EOC. We have signed on to the, what they call the CASI project, Digicel CASI project, where they have installed the fiber optic, how do you call it? Fiber optic.
A network, yes.
A network. And also, Flo was, you know, happy enough to come to help us with our building redundancies. So we have also Flo, who has also installed the fiber network service for us. But with both of these things, we still cannot function as we should. Our connectivity is not as good, so we have to put the network switches in place. So through the World Bank, we are doing that also. We have also ordered through the World Bank 2 search and rescue drones, and we are doing this project together with the fire service. That has been approved also. We are building redundancies in our telecommunications, and through the World Bank again, because it was a DVRP project, and we had to look at our gaps and see how best we can use the funds. So the handheld radios will be, the VHF radios will be installed throughout the length and breadth of St. Lucia. Last year, starting June last year, what we did, we had VHF radios that were handed to the district disaster committees, but they were placed at the various satellite warehouses. Now, some of the locations are not the best, and they do not have backup power. So what we've done, we have transferred with approval from the fire service, the police service, police department, we have transferred all of our base stations and our radios there so that in the event of an emergency, we'll be able to get connected to communities. And all of the communities that are in locations that, like, for instance, Debara, it's a dead end. Bouton is a dead end. Techime, Forestier. These communities will receive handheld radios that will be installed at the schools. Now we know that the schools have security officers, so we'll be doing training with these security officers in the use of these radios. So what we want to do is to ensure that if there is an emergency, we are able to reach the communities that are impacted.
Okay.
So we are doing quite a bit.
Earlier on you mentioned about the shelters. I'm just a little curious. I'm familiar with the public shelters, but you mentioned something about private, considering private shelters as well.
Yes.
Just explain a little bit more about that. How is that going to work?
Well, it's at a discussion level right now. So what we realize that some communities may have one shelter. And because of the number of persons that may, if we have a Cat 5 hurricane, for instance, it may cause damage beyond what one shelter can accommodate. And so we have to start thinking ahead. Where do we put those persons who have been impacted? We cannot just leave them to roam. And so we have to identify within the community as much as possible other means of shelters. And so we are discussing possible backup shelters.
Okay. Yeah. What is the responsibility of the citizenry in terms of responding to the pending weather systems?
Okay.
Because you could do all your preparations and roll out all your plans, and if the citizens do not respond favorably into what they must do.
Indeed, we want persons to take note of what you've heard. It is an above normal hurricane season. So we have seen, we do not have to have our own experience. We learn from others' experiences. So Dominica, the impact that Hurricane Irma had on Dominica. So we're saying to St. Lucians, let us play our part. Let us put together our own family plan, right? Ensure that your home insurance or property insurance covers perils like land slippage, if your roof should be blown away, you know, ensure that you have your family pack together, an emergency pack, where you have your medication, you have food supply for at least 72 hours, you have your important documents in there, and ensure that you discuss this plan with the entire family. Identify the closest shelter to your home before the impact. There are persons within the community that you can ask. You can call NEMO if you do not have that information of who is responsible. But the district disaster committees are supposed to be visible on the ground to inform persons of what is expected of them. Now we know it is not business as normal, as usual. And so a lot of the information has to go out through social media, whatever means of media we can. And so what would happen is that the district disaster committees would go into the community and inform them. But because of COVID, they can't do that. So what we want persons to do is to listen to the sources of information that are credible. The Met Office will send out advisories. NEMO will have that information. Ensure that you do not irresponsibly pass on information that has not been verified, because we build fear in people, and we do not want that to happen. So there is responsibility. We want persons to take on their personal responsibility, families to take on their personal responsibility, especially during this hurricane season in the context of COVID.
Mm-hmm. Yeah. Mr. Joy, in terms of the information and getting the reliable information from the Met Office, what are some of the other areas in terms of your radar surveillance and so on, in terms of your networking to provide reliable scientific information to the general public?
Okay, I must first say that we do not have a radar system as yet, but it's in the works. We normally rely on the Martinic radar for information. So it's not St. Lucia alone. We have a network of radar stations across the Caribbean that we make use of. I made mention of the Caribbean Institute for Meteorology and Hydrology. We are regional. We rely on them for information, and also the National Hurricane Center. So it's about connections. So we all interconnected, especially when it comes to the hurricane season. Information is passed back and forth between different islands.
And if I may recall, we've also upgraded in terms of being able to detect water levels from rivers in terms of flooding, any potential flooding. Maybe you could speak a little about that?
No, because this is the domain of the Water Resource Management
Water Resource
Agency.
Management Unit, yes, okay.
We handle the water that comes from the sky. They handle it on the ground.
Okay.
Yes.
Very
Partnership.
Partnership, okay.
Yeah.
I think Ms. Gusta wants to say something about that.
I just want to speak to early warning system as you spoke, the water level. We have early warning systems in 4 low-lying communities. Denery, Castries, Ancillary, and Canaries.
Okay.
We are now trying to complete the Denery system into a multi-hazard early warning system. We have right now ordered a siren system that will complete that system. Right now, Denery has what you call a flood early warning system.
Okay.
And in Ancillary and Canaries, there's also, and we also have sirens at these communities. In Masha, we have 1 siren that covers the Castries area. Okay. We are looking at what we are aiming is to ensure that all low-lying communities have early warning system. We're thinking of Groseley, the major hub of tourism and so on. And we do not have one there. And we are thinking about, sourcing funds as much as possible to install an early warning system. And if you have the siren, you're able to warn people ahead. For instance, you have a tsunami approaching. It does not leave us with much time. If we have that siren in the community, we can sound the alarm to ask persons to evacuate as quickly as possible. And that is what we're aiming at doing.
With the experience of COVID, we saw when it was announced that the country would go under 24-hour curfew, a number of persons claimed or said that they were caught unprepared. But we had signs and signals before that of asking persons to prepare. We saw what was happening in other countries.
Exactly.
And even if hurricane season, when something is being announced, that's when you see persons panic buying. What can we do? What can we say again to our citizenry in terms of being prepared, which has to be the key message right now?
Yes,
being prepared. The hurricane season begins next week, but we should have been in preparation mode from the beginning of the year, if possible.
Yeah, Tony, it's not just about panic buying. Preparedness is something, to me personally, it's a mindset. You have to know that a hurricane season is coming. It has never escaped. I mean, we may escape the hurricane, but the season is every year. And so persons ought to look around their home, first of all. Ensure that your waterways are clear. We have seen a number of instances where landslides have taken because there was no clear water path. Asking persons to ensure as much as possible to strengthen your roofs. Ensure that you have done your part at your home with your family. Ensure that you put the buy-in has to take place ahead of the hurricane season. You have these 72 hours, groceries in order for 72 hours. So everyone is supposed to think of that right now. when there was a shutdown, we were supposed to cater for those persons who are shut in and so on, and that is what NEMO does. And so we continue to do that. We will put measures in place for persons who are unable to take care of themselves, right? So we'll continue to take care of those vulnerable persons. However, persons who are capable of doing, putting your measures in place to prepare for the hurricane season, please do so. Do not allow a hurricane to reach us and you're not prepared, and then you have to rush. There is COVID. Think of COVID. You rush into a supermarket, the lines are long, you know, so we have to start thinking ahead. Our thinking has to be different this hurricane season especially, and moving forward.
Certainly. We are due for another break, and when we come back, we continue for our conversation here at the Information Command Center.
Coronavirus? But children are safe, no?
Hold up. Children are actually more likely to touch all kinds of surfaces, put their hands on their mouths and their eyes, or sneeze and cough with little thought about hygiene when around others. While children have been seen to recover well from this virus, they can easily spread it to those more at risk, like the elderly or ill persons who have a weaker immune system. Teach the little ones in your care to be little powerhouses of infection prevention. Keep reminding them, wash your hands. Cover your mouth with tissue or your inner elbow when you sneeze and cough. And be sure to praise them when you see them taking these precautions.
Our health is in our hands. Together, through simple actions, we can stop the spread of coronavirus. This message was brought to you by the Bureau of Health Education of the Ministry of Health and Wellness.
And welcome back. Today we're talking about disaster preparedness with the pending hurricane season, and we have in studio with us a representative, the director of NEMO, as well as a representative from our Met office, Mr. Joye. A name I told him earlier on that means joy, so we're hoping that this year we don't have any hardships being faced with the hurricane season and that we'll all get through this in one piece. But we're also talking about caring for our vulnerable early on, as well as persons with disabilities, even during such crises.
Definitely. From last year, October, we started engaging. Well, we have started the discussion long ago, but what we did, we engaged the National Council for Persons with Disability to ensure that caregivers of persons with disability and the District Disaster Committee and whoever deals with them are adequately prepared to deal with this vulnerable group. So we did training in sign language with that group. We also did training in how to handle them, how to manage them if they were supposed to be moved from their homes into a shelter. So evacuation, how you handle those persons with disability. So at the community level, we have done this training. We're supposed to expand it to other groups in the community, but we did not. It was part of our plan for this year, but we have not done it. We wanted to do it ahead of the hurricane season. Let's blame it on COVID that it did not happen, but the plan is to continue engaging that group in all, because we at NEMO do not want anyone to be left behind. We want to ensure that in our planning, persons with disability, anybody from the community, everyone is aware and is touched by what we are doing at the community level.
So I take it that going forward, even in terms of crafting your messages, you would consider the sign language as well as our Creole in terms of making sure that everyone gets the message.
Yes, so some of the messages that we completed last year through the name evaded me now, but UNDP, I think.
Yes.
USAID, sorry, USAID of the. We had some PSAs that were completed, and it did take into consideration the sign language and also the Creole messaging. So we have started this. We plan to continue along that line.
NEMO is also involved in the National Meals Program, which started, I think, on Easter Sunday. It started.
That's right.
When the country was under lockdown and we had to assist those vulnerable persons. How has that been going?
It's been going well so far. We have fed over 13,000 meals from the 12th of April, and we are continuing this Sunday with 3,000 meals throughout the length and breadth of St. Lucia. And we are actually reaching the most vulnerable, especially the shut-ins at this time.
What are some of the other agencies that you're partnering with to ensure that this program is successful?
Event St. Lucia is doing the logistics, and SLHTA is on board. A Ministry of Equity is on the ground. They are the ones who know who the vulnerable are. And so we have partnered, and the district disaster committees, the various community organizations are on board volunteering also.
Okay. We're quickly running out of time.
I don't want to leave out this very important group, the St. Lucia Cadet Corps.
Oh yes, they would not forgive you if you
They would not.
left them out, and they are doing a tremendous job.
Yes, a tremendous job under the leadership of Colonel Hyacinth, with Major Lake and Major Shalmine on board. And every time we call upon this group, they're there, and they're tired, but they're continuing.
It shows that in spite of everything we're going through, volunteerism is still very much alive within our community.
Very much alive.
We're quickly running out of time, so let me just invite Mr. Joye for some final words. Just remind persons that we're in for a ride this hurricane season, possibly.
Yes, I would like to say that it was encouraging to see the response from COVID. I'm impressed with the citizenry, that they abided by the rules of the government, and I'm hoping that is the new normal, where when warnings are issued, that they would take heed and be prepared. Yes, because it only takes one. So even though it's an active or below normal, one hurricane can cause a lot of problems. The long-term prediction for the region is that we will get warmer. And when we get warmer, the seas get warmer, that encourages more intense hurricanes.
So you say more intense, are we going to see like more wind, more water? What are the predictions?
It's both wind and rain.
Okay.
So the intensity, you'll have below normal rainfall for the month or for the year, but then the intensity of the storm. So you'll get that rainfall in one instant, not spread out over a period. And that would cause problems because we don't have storage for water.
So we have to take heed to those warnings. Yes.
Do what rainwater harvesting, and
Okay, Ms. Gustav.
Okay, I just want to encourage St. Lucians, like Mr. Joye said, you have done remarkably for COVID, and so let us continue taking heed. Let us not say God is a St. Lucian. Let us ensure that we put our measures in place. And remember, it is just a prediction. The prediction can go either way. And if we inform that a hurricane or St. Lucia is under hurricane watch or warning, and we are spared, let us say thank you, God, and not complain and say that,
or blame NEMO, or blame the Met Office,
So encouraging St. Lucians to be prepared, or be ready, so you will not have to get ready. Go to the App Store on your phone, on your mobile phone, download the cap.cap app. We will be updating you through that means of information before, during, and after an event. So it's easy. It does not take any space on your mobile. Download that app, and you will get reliable information from NEMO on that app.
Do you have a checklist as far as what persons need to have in storage as they prepare? I know every year you tell persons, perishable, non-perishable item, what have you, but is there somewhere one could go to get a checklist?
There is a checklist. They can call NEMO, and get that information. Or I can make it available to NTN and you can put it up.
Certainly,
yes,
certainly we will definitely do
yes.
that. And again, I just want to thank our listeners, our viewers, that this is the place to come to for the reliable, correct information, timely information. Please stay away from the fake news, as Ms. Gustav said. You know, make sure you have the right information. We do not deal with hearsay in times of emergencies and hurricanes and even with COVID-19. Please stay plugged into reliable and correct information at all times. Thank you again for joining us here at the Information Command Center. Once again, we ask you to continue to be safe, obey the protocols being put in place by the Ministry of Health as we continue to battle COVID-19. We're not in the all clear. Earlier on today, we heard from the Chief Medical Officer saying that COVID-19, based on the scientific research and everything that is being said scientifically, will be around for a couple of years to come. So we are not in the all clear yet. So continue to obey the protocols, practice physical distancing, and if you have to go out in public to acquire some of the services, the banks, the supermarkets, or what have you, be sure that you wear your mask at all times. St. Lucia, continue to be safe and be prepared at all times. The hurricane season begins on June 1st. So take heed, take all precaution, and remain safe. Thank you for joining us. That's my time for now. Goodbye.